Hi, thanks for coming in. My name is Faith and I'm going to be your provider today. And today we're going to do your assessment. So, immediately I am noticing that you have no respiratory distress. Your respirations are even, equal, unlabored. You don't have any dyspnea, no accessory muscle use is being used, you don't have any nasal flaring, no retractions are observed. You appear well nourished, you appear hydrated, you appear in good hygiene. Now, can you tell me your name?
Trista.
Okay, can you tell me your date of birth?
November 25th.
What year?
7.
What city are we in?
Marion.
What year is it?
2026.
And who am I?
Faith.
Okay, so you are alert and oriented times 4. Okay, so now I'm gonna, just take a look at your head, and just by looking at it, it looks normal cephalic, looks midline. You don't have any tremors. Your head looks full of hair. Your eyelashes and your eyebrows, they are symmetrical. Okay. I'm gonna take a look at your thyroid and look up for me your trachea. It looks midline. Okay, now do me a favor. Hold on a second. I know you don't really enjoy people feeling your neck, so we're gonna make this really short. Okay. I know it feels funny. All right, do me a favor and swallow.
I can't.
Okay. Try.
I did.
Okay. Swallow again. Don't laugh. All right. Swallow again. Okay. Thank you. Your thyroid is not enlarged. There are no nodules palpated. In fact, it was non-palpable. Now I'm going to take a listen to your carotid artery, okay? When I listen to your carotid artery, I'm just going to have you turn your head slightly away, okay?
Like that way?
Uh-huh. Yep, so I'm going to take a listen to this side first, and then I'm going to take a listen to the other side, okay?
On my neck?
Yes, it's in your neck. All right. Okay. So, take a deep breath, and then let it out. Ready? And there you go. Now hold. All right. No bruise noted. I'm going to take a feel. Okay, it's 4 out of 4. All right. Come on along here. I'm just going to palpate here. Okay, 4 out of 4. All right. Turn your head just slightly that way. Take a deep breath and hold. Or take a deep breath, exhale, and hold. Okay. No bruit was noted. So I pupetted both. They're both 4 out of 4. All right, now we're gonna look at your facial features. All right, so like your ear, eyes, nose, and throat things. Okay. Um, I would like you to smile. We're gonna do your cranial nerve 7. Okay. So if you could just, if you could smile, puff out your cheeks, raise your eyebrows, smile, smile, puff out your cheeks. Raise your eyebrows. Okay. Close your eyes tightly. Good. So your cranial nerve 7 is intact. Do me a favor. Clench your jaw. Any pain with that? Okay, good. Your cranial nerve 5, that's your trigeminal nerve, that is intact. We're going to do your lymph nodes real quick. I'm going to feel your lymph nodes. All right, so I'm going to be touching you. I know that kind of weirds you out a little bit, so I wanted to warn you. So I'm going to feel your face and around your shoulders, okay, and the back of your head, okay? All right, so we're going to do your preauricular, all right, and we're going to do your postauricular, and we're going to do your submental and your submandibular, and we're going to do your occipital, and you're going to do your cervical. This is really not easy to do with your sweatshirt on. And your posterior cervical. There's your cervical. Sorry. I wasn't paying attention. Your posterior cervical. Your supraclavicular. Look at your eyes. They are, I love that you're looking around. I know. I'm gonna look at your I'm going to look at some other cranial nerves, okay? So I'm going to look at 3, 4, and 6, all right? So we got your oculomotor, your trochlear, and your abducens, okay? So I would like you to follow my light. I'm not going to shine it yet, but I want you to follow my light, all right? And I'm just going to move it into motion. I want you to follow my light in the shape, okay? And I don't want you to like move, I don't want you to move your head, just your eyes, okay? All right, ready? Okay. Okay. So, we have your 3, 4, and 6. They are intact. Now, I do have another one that I would like to do. It is your cranial nerve number 2. It is your optic nerve, and I want you to tell me tell me when you see my fingers move, okay? Because I'm just going to be wiggling my fingers. I want you to tell me when I'm going to be, tell me when you see them, okay? Because this is going to be testing your peripheral vision, okay?
Whole time.
The whole time? Okay,
I see them the whole time.
okay, all right,
I see them the whole time.
okay. The whole time. Okay, good, good. All right, so your optic nerve 2 is it's intact. I would have you look at the Snellen chart, but we're not set up like that because we are not an eye doctor office. I'm going to turn the light out because I'm going to take a peek in your eye. Okay. It won't be long, so don't worry. But I do have to take a peek. So give me just a moment. Reflex is intact. There's the yellowish pink optic disc. I see the macula and the fovea. There's no AV nicking noted. No hemorrhage or exudate is noted. Oh, the dogs are walking out. All right, let's look at the other one. Alright, just look over my shoulder. Alright. The red reflex intact. There's the yellowish pink optic disc. I see the macula and the fovea. No AV nicking is noted. No hemorrhage or exudate is noted. All right. Okay. Now I'm gonna take a peek up your nose. Won't be much. I'm just going to take a peek. I mean, your nose, just by looking straight on, it does appear midline. But I'm just going to take a peek up at here. Your nares appear patent. Nasal turbinate appear without swelling. They're pink, and honestly, I don't see any drainage or no exudate, no drainage noted. I'm gonna palpate your sinuses. Tell me if you feel any tenderness. There's your frontal. Any tenderness there? Okay. Maxillary, any tenderness there? Okay, good. So non-tender sinuses. All right. I would like you to close your eyes for a second. You are gonna help me. All right. to check cranial nerve number 1. That's your olfactory nerve. I would like for you to close one nostril with your eyes closed. Close one nostril, okay? And I would like you to smell. Tell me what the smell is.
Banana?
Yes, open your eyes. It's a banana. I hope you're in the mood for a banana today. I haven't touched it, just the peel. Okay, you can unplug your nose. You're correct. So, cranial nerve 1 is intact. Sorry, I do have to touch your hair. Your ears do appear symmetrical. I'm going to take a look at the outer part of your ear, then the inner part of your ear, okay? Let me grab my light. Don't get any crazy ideas, dog. All right. All right. So, I'm going to look at the auricle. I'm going to look at the tragus. They're both mobile. Is there any pain when I'm moving it around? No? Okay, good. Good. Okay, there's no pain. Now I'm going to look at the inside. I also notice on the outside, on the external part of your ear, there is no drainage. Okay? There's no scaling noted. Alright, so now, come on. Okay. Now, we're going to look at the inside. Alright. Okay. Alright. Alright. I see the tympanic membrane. It's the pearly white. It's intact. There's no bulging or erythema noted. The cone of light is at 7. Okay. All right. I'm going to take a peek at the other one just to make sure. All right. Auricle, tragus, they're mobile. Again, no scaling is noted, no exudate is noted. Are they painful when I'm moving them around? No? Okay. Alright. Take a peek. Oh boy. We're just looking at. Alright. Tympanic membrane is pearly white. It's intact. No bulging or erythema is noted. And the cone of light is at 7. All right. Okay. All right. I'm going to do the cranial nerve number 8, which is the vestibular cochlear nerve test. I'm going to stand behind you, and I am going to whisper something, and I want you to tell me what I am saying. Okay? Correct. So your vestibular cochlear nerve number 8 is intact. All right, now we're moving right along to your lips and your mouth. All right. So I would like you to open your mouth, please. All right. Can you stick your tongue out and say ah. All right, that's perfect. Okay, all right, okay, that's enough. All right, cranial nerves 9 and well 10. Glossopharyngeal and vagus. They say that kind of stuff. Those are intact. Your teeth I see are intact. No decay. Very pretty. Of course, I also know, I paid for those, so they better look pretty. Very moist inside. Your tongue is midline. When you said ah, your soft palate rose symmetrically with your phonation. Your mucosa is pink, moist, no lesions. Ooh, boy. There we go. Oh, stick your tongue out a little farther. There we go. That's pretty. You have no tonsils because we had those removed. No cobblestonings noted. Let's see. I know why. I'm sorry. Can you lift your tongue up for me? Okay. Oh, come on now. Come on. Your tongue's midline. No tremors except for when you're laughing. Pink, moist, no lesions. I don't see any exit. Oh, stick your tongue out. I don't see any. Swallow. All right, stick your tongue out. Stick your tongue out all the way. All right, I don't see any exudate in the back of your throat. I already said cobblestoning. All right. Let's see. Wait, hold on a second. One more time. Okay. Let's see. Let's do your cranial nerve number 12, your hypoglossal. So stick your tongue out one more time. I already checked for your midline. And then move your tongue side to side. Okay, good. Yep, your hypoglossal cranial nerve is, it is intact as well. Can you pull your sleeve up for me? Okay, that works. I'm gonna look at your skin. Cause let me look at this arm. There we go, that's what I'm looking for. Alright. I needed to find what I could talk about. Alright, so we have, well, it's not necessarily a lesion, but it's a nevus. It's symmetrical. The borders are even. It is a nice medium brown, maybe about 2 millimeters in diameter. No changes really with it. Would you agree? It's been about that size, yeah. It's normal appearing. There hasn't been any itching or bleeding or anything with it. Okay. So it's just a normal appearing nevus. Alright. Alright. Now we're going to move along to your chest. Okay? We're moving along pretty quickly. Alright. So, alright. So, when I'm palpating it, let me take this out of my real quick. When I'm palpating it, I know, it feels weird. Are you noticing? I'm not noticing any masses. I'm not noticing any crepitus. Is this tender at all when I'm doing this? I know it feels weird, but is it tender?
No.
Okay, alright.
A little bit right there.
A little bit right there. Okay. You think I was just maybe pushing a little too hard, maybe? Okay. Alright. Alright. I'm going to take a listen to your heart and your lungs. Okay? Alright. We'll start with your lungs. to your back. Okay. Alright, and while I'm here, I want you to tell me, move forward just a tiny bit. Alright, tell me if there's any tenderness with this. Any tenderness? Okay. Tell me if there's any tenderness with this.
No.
Okay. Your lungs sounded clear. There were no adventitious lung sounds. Okay. You haven't had any cough or anything, correct? Okay. No shortness of breath as well. I know I haven't noticed any throughout the assessment, but I wanted to make sure you haven't been dealing with any as well. All right. Okay. Now I'm gonna take a listen to your heart. Okay. All right. So that means I'm gonna try and fix your sweatshirt. Okay. Okay. All right. All right. So I'm gonna first listen to your aortic, and that is in this left second intercostal space. Okay. Now I'm listening to the pulmonic. And that is in the right. Second intercostal space. Now I'm going to listen to the Erb's point, which is in the third intercostal space. Now I'm listening to the tricuspid, which is in the fourth intercostal space. Now I'm listening to the mitral, which is also the point of maximum impulse, and that's in the fifth intercostal space at the midclavicular line. Okay, I'm gonna come back up here and listen with my belly here. Okay. I noticed that your rhythm was regular, crisp, S1, S2. There was no S3 or S4. There was no murmurs or splits. You had good heart tones. Okay. So now we're gonna move on to the couch. If you could please lay down for me. Okay. Okay. All right. Here we go. Yes, I know. All right. So I am gonna pull your sweatshirt up a little bit just so I can show your abdomen here. No, you need to move. All right. Okay. So just looking at your abdomen, it looks symmetrical. It looks non-distended. It yeah. I'm gonna take a listen to it, and I'm gonna listen to your vowel sounds, and then I am going to feel it, and I'm gonna then I'm gonna feel for your liver, okay? But I'm gonna listen first, okay? Hopefully they behave. All right. Well, while I'm listening, let me make sure you can see. Okay. I'm gonna, please don't laugh. Oh dear Lord. Okay. I'm gonna listen to your aorta. Okay. No bruit. And listen to your renal arteries. Listen to your iliac arteries. Now listen to your femoral. Okay. No bruise noted in your aorta, your renal arteries, your iliac arteries, or your femoral arteries. All right. So now I'm gonna feel your abdomen. Okay. I do not notice any masses. Is this tender to the touch? No? Okay. Okay. Now I'm going to try and feel for your liver and for your spleen, okay? Okay? So I'm going to feel a little deeper, okay? Just a little deeper. It's not going to hurt, okay? Please don't laugh. Okay. Your liver is not really palpable, so I'm going to try and palpate your spleen. I'm sorry. to palpate your spleen. So now I'm going to okay. So your liver is about four centimeters from the MCL. All right. While I have you laying out here, I'm going to take a look at your legs. Please get off of her legs. Thank you. All right. I don't notice any edema to your legs. I'm sorry. I do not see any varicose veins. Okay. Please push against my hands. Okay. Pull towards you. Okay. 5 out of 5. Grab, squeeze as tight as you can. Okay. Good hand grips. They're equal, and so were your feet. Okay, you can stop. Okay. Go ahead and sit up. Dangle your feet. Okay. And then push towards me. Okay. And then pull towards you. Okay. And then lift your arms towards you. Okay. And then push down towards me. Okay. Okay, your legs and your arms are both 5 out of 5. Okay. I'm going to test your reflexes now. Oh man, I should have put a pad on my legs. Phew. Okay. I'm sorry. Okay. So. Okay. All right. Oh my goodness. All right. We're gonna check your deep tendon reflexes. Relax. Come on. Okay.
Your foot is relaxed.
Yeah. Okay. Okay, well, we'll come back to that. I'm going to check your dorsalis pedis, your pedal pulse. Mm-hmm. Okay. And then your dorsalis pedis. And your post tib. see your arms, please. Okay. Okay. Your pulses are all equal, and they are all very strong pulses. They are 404. All right. Relax.
I am wrong.
You say you want to put your arm. There we go. Good. Okay. Let's see this. All right. I know. Let me move this chair out of the way. So, all right. Your DTRs are a 4 out of 4. So I checked your Achilles, which was at your foot. I checked your popliteal. I checked your brachioradialis and your biceps, triceps. So if you could stand up for a second. I would like to see you do the Romberg test. Okay. So if you could let your arms hang to the side and put your feet together. Okay. And just close your eyes. Okay. And so I'm glad that you are maintaining your balance and you're not moving, and so that is good. That's normal. And if you could just kind of walk towards the camera real quick, open your eyes. If you could just kind of walk towards the camera and then turn around and walk back. Okay, and then that's it. Go ahead and turn around. So not only did you have a normal Romberg test, you have a normal gait, very steady. Really, that just kind of concludes the assessment for today. Again, thank you for coming in. I appreciate your time. You know what, there was one more thing. If you could just have a seat. I did forget to check one thing. I do have to check your feet. A foot assessment is very important. I know. I'm sorry. I have to take your sock off because I have to do an assessment.
I need to put my hands.
So I noticed with your feet, they are in good condition. I don't notice any open areas. They are a little dry, but I do need to know, close your eyes for a second. Just close your eyes. Okay? Can you feel this?
Mm-hmm.
Uh-huh. Okay, how about this?
Mm-hmm.
Yeah?
Yeah.
Okay. Alright, so you have full sensation in your toes. And that really concludes the assessment. Thanks again for coming in, and I hope you have a wonderful day. Oh boy.